Hello, I'm Dr. John McDougall. Welcome to the series Star McDougallers in Their Own Words. John Roberts has a very important story to tell us about one of the most important topics these days, and that's high cholesterol.
Well, John, you and I grew up in the Midwest, and we both shared a lot of the same common health problems. The standard diet that you and I consumed when we grew up in the Midwest was a heavy diet, and we both had some of the same health issues. And that ranged for me from arthralgias, my joints often hurt, to what we thought back then was allergic rhinitis or just allergies. But later I learned that that's really not what the problem was. And then I also had dermatitis when I was growing up as a kid. And these are problems that I expected that I would probably have to live with for the rest of my life. It was later on in life when I got away from home and started working on my own that I started worrying about my cholesterol. My total serum cholesterol was running somewhere in the high 200s to the low 300s. And at the same time, my father was taking medication for high cholesterol, so we figured, okay, this runs in the family. And I can remember my father was taking some medication, and if we looked at the crimp or the paperwork that came with the prescription, it said that, warning, this pharmacy, I should say pharmaceutical, is known to cause cancer in laboratory animals. And all I could think about was, gosh, what a paradox. You have to choose between heart disease caused by high cholesterol or hypercholesterolemia and taking a drug that could cause cancer. But it never happened, it didn't seem. But then finally it did happen, and my father did get a bladder cancer. We encouraged him to try to address his cholesterol issues through diet, and back then we thought exercise. But I remember his infamous quote was, "If my doctor didn't think this was good for me, he wouldn't have prescribed this." Well, he went through surgery and had the bladder cancer removed, and lo and behold, his doctor put him back on the same medication, even with this warning that this medicine could cause bladder cancer in laboratory animals. And a couple of years later, my father developed a second bladder cancer and had to go through surgery once again, in which case his children, me included, implored him to get off this medication. But all I did was heighten my resolve that I really don't want to deal with this medicine versus hypercholesterolemia issue. But it wasn't long after that I heard William Castelli, a medical doctor with the Framingham Heart Survey, say on national television that in the Framingham Heart Survey, he was unable to find any of the subjects of the study who had heart disease who had a total serum cholesterol of 150 or lower. So I thought, that's exactly where I need to get. And I had the radio on, and this guy, John McDougall, was on the radio. And I'll never forget as long as I live, the first caller was a woman with breast cancer. And Dr. McDougall was so compassionate that it was the most compelling radio I'd ever heard. I mean, I was glued to the radio. As it turned out, the next caller was a man with the exact same problem I had. How do you get your cholesterol down to where heart disease is no longer a problem? And Dr. McDougall told him, and I knew right then that that's what I have to do. This is how I can get to 150. And it worked. And so now, with a very patient doctor that I had at the time, where I would go back and do trial and error, I would say, I want another lab slip for a blood workup. For cholesterol, and he would look at me and say, again? But it was an iterative process. I would try it, and then I would go off, and then I would try it, and then I would go off. And I can say unequivocally today, I know exactly how to get my total serum cholesterol to 150 or lower, and that is to follow the McDougall diet. You could easily say that the side benefit to getting that cholesterol level down was the fact that all of these other symptoms that I'd grown up with as a child, which were what we suspected were allergies, and then the dermatitis, and then the arthralgias or joint pain. I don't have those anymore. There are times when I might have a sinus headache now and then, but even that's rare. But those symptoms have all completely disappeared with the slight exception of the sinus headaches, which I'll get in the winter sometimes. When people notice how I eat and they notice that my health is quite good for a man my age, they ask, they inquire, and I generally I've learned to be very patient and maybe less enthusiastic to kind of tone down the message. But I found that over a period of time that I just simply say that it's what works for me, and that I'm unequivocal that it works for me, and that sometimes I will be asked to show lab reports, especially to my physician friends, and I've saved all my lab reports, so I do. And I would say patience is the way to do this, is to help see yourself as an educator, not as a proselytizer. And if you do that, I think the acceptance level is higher. But I would say not a day goes by when somebody doesn't ask me something or call and ask for a tip or a suggestion. The message that I would have for people is take control of your own health, do your own thing, find a patient doctor who will work with you and help you do this trial and error process that works so well for me. And don't be dissuaded. I mean, it's like I said, it's about a 15-year period for my discovery, and it might be shorter for others, but that's how long it took me. Probably the key to this discovery is getting good information. And there's so much bad information out in the marketplace that people are exposed to every single day. It's really important to get a hold of good information that you know is reliable and trustworthy, and that nobody's trying to push medication on you or any other kind of medicine, but rather to help you get well. And the one advantage that I've been able to see in the McDougall program is coaching, encouragement, and most importantly, trustworthy information. That's the main value for me.
John Roberts had many things to share with us about the effects of diet on his personal health. But I think the most important thing for him was his cholesterol, those numbers. Those numbers are things that people fixate on a lot. He started with cholesterol in the high 200s, low 300s. And then he changed his diet and he dropped it to below 150 milligrams per deciliter. People focus on numbers. The drug companies want us to focus on numbers. Why? Because they can treat numbers. That's right. They have pills that will lower our cholesterol. But they don't focus on the real problem. People don't die of high cholesterol. No, they don't die of high cholesterol. People die of what? They die of rotten arteries. They give you strokes and heart attacks. Why don't they focus on the rotten arteries? Because they have no pills to do that. You'd have to change your diet to fix the underlying disease. They have pills that change the numbers. And that's why the benefits from cholesterol-lowering medications are so small. Yeah, you can lower the numbers, but when you look to translating that into better lives and longer lives, you really don't see much change. Now, I think it's important for you to know your cholesterol. I think it would be a good motivator for you to change your diet to a no cholesterol diet. You do realize cholesterol is only found in animal products, meats, dairy products, fish, chicken. And so, obviously, how would you fix a high cholesterol level? You get those foods out of your diet. Instead, focus on no cholesterol foods, which are your vegetables, starches, vegetables, and fruits. And so you change to things like bean burritos, oatmeal for breakfast, vegetable soups, rice and mushu vegetables, all kinds of different things that are delicious. And then what happens is your cholesterol goes down. For example, my cholesterol, when I started this at 22 years of age, was 335. Well, it took me a while to change, but fortunately at my age, more than 40 years later, what I find is my cholesterol runs 150 milligrams per deciliter or less with no medication. That's the way it needs to be. You need to correct the underlying problem. The numbers get better afterwards, but the important thing is that you keep the body healthy and you remove the cause of all that sickness. You get off those pills. Sick people take pills. Healthy people don't. John Roberts has avoided taking pills. You should too. Use them only as absolutely necessary and correct everything else you possibly can, including your diet. I'm Dr. John McDougall.